Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas, an expert in the area of personality disorders. And recently, I've been getting a lot of folks who've been writing me asking about covert narcissism. What makes up covert narcissism behavioral expressions, and things of that nature. So I thought what I would do is make a video on these 4 components, as well as I'll talk about the subcomponents that make up covert narcissism. And hopefully this can help you identify it in yourself, identify it in others, so that you're aware of who's in your interpersonal circle, sort of what tendencies they have, behavioral tendencies, and perhaps build some insight in yourself as to how they see the world. So let's get started. So covert narcissism, this can occur in anyone. This can be your parents, your friends, your coworkers, your bosses, your significant others. Covert narcissism is harder to identify than overt or grandiose narcissism. A grandiose narcissism is sort of what we expect, right? It's my way or the highway. I know everything. No one else knows more than I do. But these folks know very, very little. And what happens is that your overt narcissism is so grand, and they're sometimes very pompous, depending on where they are on that continuum of narcissism. And so they're easier to identify. Your covert narcissism is very different. It's harder to identify. It's atypical than what we expect to see and what we expect to find. Now, again, in this video, I'm going to discuss the 4 components that make up covert narcissism, and that's going to be their self-concept. We'll talk about interpersonal aspects, social aspects, how they like to present socially, and what is their ethicality, what's their ethical components. And the whole idea is so that you can learn this, again, if it's in yourself or those that you know. So let's get started. So the first one, let's talk about self-concept. Now, in your covert narcissism, their self-concept, they tend to hold on to this idea of inferiority, a lot of self-doubt. They often feel very ashamed, very fragile, and they're sensitive to any setback and criticism. So often what happens is that they're set off into something and they start to suffer. They start a wheel of see how I suffer. And this wheel of see how I suffer is that they suffer more than anyone else. And that's where that narcissism comes in, and that's why it's kind of hard to identify, is because they are often that I suffer more than anyone else. My suffering is unique. My suffering makes me special in a way because I suffer more than anyone else ever has. Treatment-wise, they're very, very complex people to treat. A lot of times it's that recognition of that core concept, of which is their self-concept of inferiority, self-doubt, feelings of shame, fragility, as well as that's sensitive to setbacks and criticism. So treatment is very tricky because we want to get to that self-concept. Now, what about interpersonally, right? When they interact with others. So a lot of times they don't depend on others, they don't trust others, right? They're very distant because they have that internal, that core self-concept of sort of that inferiority, self-doubt, shame, other types of issues, and a lot of envy of others' talents, possessions, and capacity for deep relationships is often impaired. I did a video on jealousy and envy. I'll put a link here if you're interested in that. But here for these folks, interpersonally, often, well, why does he or she get that? And if there are components of antisocial components, sometimes they can be very passive-aggressive, very destructive, and act out in a way to hurt those. And not necessarily physically hurt, not always, but in some cases. But could be financially hurt, socially embarrassed, whatever it is, that they use that. So interpersonally, that they're very envious, so they want to take that person out, take them down. And then there's a lack of regard for boundaries. And often what happens is you see this, is that these folks are often calling you all the time about how hard it is for them, how much they suffer. And it becomes very one-sided conversations. And in these conversations, they're telling you how much they suffer and how much they hurt and all these other things that they don't hear your side of it or issues that you have. So every time you have a conversation with them, they turn it to their suffering, their pain, their experience, which is so vast and so intense and is so much more than anyone else that no one else can understand how unique their suffering is. And the last one is they have disregard for others' time. So if they know that you're out on a special date with someone, or if you're having a special time with your kids or your family, they might show up. They might show up at work in a big meeting and be like, look, I'm suffering, or show up crying at your at a party that you're at, or a social engagement, to draw that attention, because that covert narcissist needs to be seen as special for how much they hurt. So interpersonally, they're very destructive as well. Now, what about socially? These folks are nagging a lot. They nag continually. Little vocational commitment. A lot of times they may change jobs very quickly. Very little commitment to one sort of vocational track or skill track in order to, so their finances are often waxes and wanes. There's a lot of multiple superficial interests. So one day they might be interested in computers and then coding, and then the next day they want to be a film director, and the next day they want to be, an actor or actress or whatever it may be. So it's all these superficial interests, and they don't really dive deep into anything, because again, that narcissistic, covert and overt, is fear that if I get involved and if I try, I'll find out and fail. And they're often very afraid of that. So that's why for most narcissists, covert and overt, they have very, very little vocational attainment. Very little, because they're afraid that they'll fail. Okay? And a lot of chronic boredom. And they expect the world to entertain them. Now, then we're back to covert narcissists, that they expect to be entertained. Now, your overt narcissist is also like this as well, is they expect the world to entertain them. Well, I'm bored, so do something I like. We're supposed to seek out what we like on our own. That's because we know that we like it. These folks don't do that. They have chronic boredom. Entertain me, keep me interested, because that's your job. Otherwise, I am the most bored, and I suffer the most through my boredom than anyone ever has. I'm the most bored that anyone has ever been. And that could be a common statement or theme that you would see with these covert narcissistic individuals. And the last component is ethically. Where are these folks ethically? Now, they'll often shift their value in order to gain favor with those that may shine, those that they see achieving particular things that they deserve, that they feel they deserve. A lot of lying, a lot of pathological lying, misrepresentation of self is very common for your covert narcissist, also your overt as well. And a lot of delinquent tendencies, acting out, destruction, certainly emotional destruction, certainly can be property destruction. Very little regret for their behavior because it's your fault that they behave that way. There's no sense of that responsibility. We see this in both types of narcissism, overt and covert. And so they're not going to be like, you know what, I really overreacted, it's my fault, or if you've experienced a loss, they don't care, because your attention should really be on them. And if you're like, look, I'm suffering, I'm going through something, like, oh, it's always about you. You never care how much I suffer, except you spent years listening to them talk about how they've suffered. So they don't see that, right? It's that impairment in perception of self, that impairment in insight, which is that universal component across all personality disorders, is impairment in insight. And last is that disrespect of authority. Now, your covert narcissist feels that, as well as your overt, that they feel like no one should tell them anything because they know everything. Your covert narcissist is, if they are impacted by authority, who is this person to hurt me this way? Who is this person to drive me with so much pain and injustice? Could be cries for injustice. You'll see that they'll often make claims of social injustice, and they're not really founded. So you're sort of like, well, that's their perception, but remember that lack of insight, so they only see how they're hurt and their loss. So those are those four components: self-concept, interpersonal, social, as well as ethical. Now remember, like all disorders, covert narcissism is on a continuum. So you have mild, moderate, severe, and extreme. Now the way that you would determine where these individuals are on that continuum is sort of by the degree of the expression of those traits, okay? As well as the degree of impairment and socioeconomic dysfunction. How destructive to their own life are these individuals? Is their social world really adversely impacted, and that helps to determine where they are in that continuum. How about their economic life, right? Are they able to earn a living stable? Are they able to have a job, stable income? Now, the more stability they have, the lower they are in that continuum. Could be mild, below moderate, right? And the more destructive they are, the higher they are, which could be severe or extreme. Now, if you feel that some of these aspects are representative of you, or someone in your life, you may want to seek out mental health treatment to sort of explore this. And what is it about these individuals that you're keeping in your life, or about yourself? What are some of those things that you can look at and assess to do things differently for yourself if you feel like these components relate to you, so that you're not operating from that self-concept component, that core concept of inferiority, shame, doubt, fragility, and this sort of sensitivity to setbacks. That how can you overcome that? By building this sense of self-concept, by doing things differently for yourself. No one else can do it for you. A significant other who loves you very much will not be able to change your self-concept, and you cannot change someone else's self-concept if they are not willing to do so. So it's important to realize that. Sometimes that's a really hard thing for a lot of my clients to come to terms with, is I can't change him or her. I can only change me. And that's a hard thing, because a lot of choices have to be made once you come to that realization. And I hope that you've enjoyed this video. You're welcome to check out any of my others. That'd be great. Or please subscribe. And if you have any questions or comments, please leave them in the comment section. That would be great. And thank you again for your time and attention. I hope you found this video helpful. And thank you very much again, and take care. Bye-bye.